Let me just expand my screen here. Thank you so much for inviting me. This is an extraordinary conference, and I'm glad to be able to hopefully contribute some new ideas for you. But yeah, obviously, we've all lived through some extraordinary times these past couple of years through the worst of, I hope, the pandemic. But it's also been a catalyst for innovation, and in some ways, we're going to come out the other side of the pandemic better. We've had to innovate. We're going to have to use new technologies to do things in different ways to protect us all and to deliver better healthcare around the world. And so that's something that I'm very excited about. As I say, the sky is not the limit. And I should know, because I'm an astronaut. I've had an opportunity to go to space a number of times, and also some other extraordinary places on above and deep beneath our oceans, even to the top of our planet on the summit of Mount Everest. And the reason I bring this kind of background up is that when we do challenge ourselves through extreme environments like this, new innovations do come about. I'm going to talk about a couple of areas that are very exciting: telemedicine and teleoperation of assets that are now, as catalyzed by the pandemic, going to become much more important for the care that all of us receive around the world. And we need to deliver care where people are. Of course, one of the best places on the planet to get sick is in a hospital. So there's a lot of imperative, I think, to think about ways in which we can do preventative care and also interval assessments of health at home, and even one day to deliver teleoperated surgery and other procedures in smaller clinics, even in more remote places around the planet. And we have the tools almost ready to support all of that. So my mantra in life is, all of us fortunate enough to be in healthcare have both an opportunity and an obligation to innovate. I think if we were always doing things the way we had done them before, we'd be nowhere. We'd still be doing bloodletting for everything that ailed us. So we need to continually press the boundaries of what's possible. And I think we live in really extraordinary times. Certainly in the space program that you've been following, I'm sure, all the amazing things that are happening with SpaceX and Blue Origin and with NASA and Virgin Galactic. Space is going to be a place for all of us, and big thinkers like Elon Musk are even proposing that we become a two-planet species, that we colonize Mars one day. And he's actually investing in this, building rocket ships that would take 100 people at a time to go colonize Mars. I think that's a noble, worthy goal. Obviously, though, we have a lot of things we need to address here on Earth, and we can do that through some of the technologies that come from these investments in spaceflight as well. Another thing that's really an extraordinary asset is that our entire planet will be 100% online very, very soon. The photograph on the left is actually a photograph I took in a very, very remote part of Nepal, where there's no roadway, there are no power lines, there are no telephone or other infrastructure capabilities in this remote part of the country, and yet people have the ability to be online now. And this is through Starlink and other types of satellite assets. We're all going to be connected, bringing places that were never on the grid fully online, and we can take advantage of that as healthcare deliverers to provide the same quality of care that we have in our major urban centers, even in remote parts of our planet. And that's really, really exciting. So, I've been a part of telemedicine for many, many years. As part of the space program, we have to take care of our astronaut crews in space, and of course, it's a driving function as we start to think about going beyond the International Space Station and beyond the moon to even places as far away as Mars. And in those types of environments where you're so far away, teleoperation may be more difficult because of the time it takes to get a signal out there. So there are all sorts of other technology spinoffs that we could talk about some other time. But healthcare is going to be an incredible beneficiary of all the investments we've made in space. One of my prior engagements was actually overseeing healthcare for the United States Antarctic program. We send about 3,000 people to the bottom of the world every year, scientists and engineers who are working in very austere remote environments. And if they get sick, we can't just fly them out. It's very, very difficult to get a aircraft in or out, especially during the long winter's night in Antarctica. So we have to use telemedicine assets, and we've done that very, very successfully, delivering anesthesia by coaching from Galveston, Texas, actually. The application of an ultrasound done by a practitioner who's never held an ultrasound probe. So these are driving functions that will allow us to deliver high quality care all around the world very, very soon. We've also had extraordinary advances in human machine interfaces, and that's an area of great focus for me. What you see here is actually the capsule of Mercury Friendship 7 that was piloted by John Glenn, an astronaut that who I flew with on one of my space shuttle missions, believe it or not. But back in the very early days of space exploration, astronauts had a challenge to be able to control their spacecraft in three-dimensional space, especially if they had a leak in their spacecraft and their spacesuits puffed up. They wouldn't be able to use their feet. And in this setting, they ended up inventing a rotational hand controller. This is back in the late 50s, actually. Really revolutionary idea at the time. I've taken this several generations forward as the foundation of my company, Fluidity, which is all about precision of motion and intuitive motion through three-dimensional space. So everything from drones and electric flying cars, as you can see me flying here, to one day even surgical robotics. Imagine a surgeon in Houston, Texas, where I live, operating in sub-Saharan Africa with the same precision and same control and dexterity and tactility as he or she would have right next to the patient. And these kinds of tools may sound like science fiction, but they're really just around the corner. And this sort of capability is actually being demonstrated. This is an experiment several years ago. A surgeon in Cleveland, at the Cleveland Clinic, operating a surgical robot in a simulator about 1,000 miles away at a facility called Aquarius in the Florida Keys. So this kind of capability is going to be part of our collective futures. And then finally, I'm really incredibly excited about the ability to monitor and engage with patients where they live. Remote patient monitoring is really going to be catalyzed by the pandemic. Even elderly patients have all grown accustomed to Zoom conferences and even interacting with their physicians online, and they actually prefer it. And we really need this capability because 60% of Americans, and the statistics map similarly around the world, have one or more chronic illnesses. And so imagine if we could monitor patients at home, adjust their medications, provide goal setting such that they could actually improve their quality of care, their quality of life. We could actually keep them out of the hospital, reduce care costs. It would be an amazing win for all of us. Not only to extend life, but to improve the quality of their life. And so these are very simple devices that are available all around the world. They're Bluetooth-enabled devices that connect with the smart devices that we all have in our pockets. And then they relay data to the cloud where, in this case, my company, Community Wellness, can monitor them and then communicate with their primary care physician. And so instead of just having a once-a-year interaction with their primary care physician, they're having data gathered on a daily basis. They're meeting with a coach on a monthly basis, setting goals that have great meaning to the patient, and they actually can track to show improvement, whether it's smoking cessation, weight loss, increased activity, medication compliance. Only 45% of senior citizens actually take the medicines that they're prescribed, believe it or not. But with programs like this, we can actually encourage them to have much, much higher compliance. And of course, then address the underlying medical problem that they have and extend that life, improve that quality of life as well. And of course, as we gather this data, the power of the big data that we can explore with AI is unfathomable. To be able to tease out with AI engines inflection points in disease progression to be able to intercede before a patient has that heart attack or really develops a cancer that becomes inoperable. Let's identify problems early and address it. And of course, the core of remote patient monitoring, the way that we see it at Community Wellness actually, is with our coaches, creating a human bond that allows for a patient to develop a real long-standing relationship with a coach and set goals that are attainable and meaningful to that patient. And these kinds of strategies really drive results across their lives. It's movement and exercise, sleep and stress, diet and nutrition, chronic disease education, and so many other things. So this is really a game changer for healthcare delivery around the world. And it also improves outcomes for physicians' practices. They're able to monitor their sickest patients at home and avoid those costly hospital readmissions and emergency department encounters. They can also monitor healthy patients to be able to actually get out in front of disease. If there's a change in the well-being of a patient, a platform like this is going to be able to identify it and get in with some sort of early intervention and make an impact. And of course, there's even a financial impact for the clinician. Patients that are on services like this actually generate income for the physician, so there's an incentive for them. There's an incentive for hospitals to use remote patient monitoring because it reduces the readmission rates. It's really an extraordinary way to think about healthcare for the future. So I'm just very, very excited to think about where we can all take this together. I think the tools and technologies are out there for us to really extend human life in a meaningful way, not just in urban centers, but all around the world, even in remote places. And so I'd love to take any questions if there's time for it. Thank you very much.